A new bill in California is meant to lower the rate of black women dying during childbirth. That legislation is nicknamed the Momnibus bill. It has already passed in the state legislature and is now awaiting Governor Gavin Newsom's signature. California Senate Bill 65 could be a lifesaver for expectant mothers, especially black women.
We have expert doctors, hospitals, and yet we have very high rates of maternal mortality for black mothers and infant mortality, and that's wrong. So got to fix it.
Just still so shocking. Staying with us to continue our women's health conversation, Dr. Leslie Farrington. She's a retired OBGYN. Thank you for joining us. That is just so startling, not only as a woman, but especially as a black woman. Why are we 6 times more likely to die within a year of pregnancy than white women? What's causing this disparity?
And that's in California. The numbers vary from state to state. There are multiple causes. One significant cause is the type of care received, whether the mother or the pregnant woman is being heard when she reports complaints of chest pain or shortness of breath. For example, if the mother is not heard, which is a very common problem, then the important signs can be missed, and that's why death and severe complications are occurring more, because black women are not being listened to.
Does it have
That's one reason.
Does it have, okay. Now, does this go back to that ancient saying that black people can tolerate more pain? I mean, are medical providers still believing that?
Yes, so studies have shown that there are still stereotypes left over from the days of slavery, and the stereotypes, the bias affect the care. Yes.
Which is just awful. Okay, so this bill in California, because let's talk about taking a step in the right direction. The bill would provide funding to study the disparities and also offer solutions. I know that's one step, but do you feel that's enough? And should other states follow in suit?
Well, the solutions are key. The solutions such as increasing doula access. It's been shown that doula support, the support of other women who have been trained to give emotional and physical and informational support to families, this support improves outcomes. Having a midwife can improve outcomes, can reduce interventions and complications. And it's been shown that a black woman with a black midwife and a black doula will have better support and be more comfortable and more trusting. And these types of solutions are what we need, is more doula access, to train more midwives. And that's part of that bill, to increase the numbers of midwives.
Dr. Leslie, I've read several reports about women, who gave birth, and they felt like their voices were not being heard by their doctors. And it was only until their doula stepped in to advocate for them. Why is that? Why does it take someone else advocating for me to get the care that I'm paying for and deserve?
There's a long history of sexism and racism in healthcare, going back to when the practice of OBGYN, the specialty of OBGYN, was developed on the bodies of enslaved black women. And women have always, especially pregnant women, have always been treated when coming into the hospital and sometimes into the doctor's office with a paternalistic attitude, that you're not completely in control, that they know what's best, and you're not allowed to do this and you're not allowed to do that. And especially in the case of Black women, there's even more disregard, less valuing of their lives.
Yeah, I mean, you think about a woman like Serena Williams, a wealthy woman going through something similar to a woman with little means. You
Yes,
mentioned,
she knew what was wrong, and
yeah,
she told them, because she had experience. So they're not listening, and this is something that she brought out. Many Black women are bringing this out.
absolutely. And the study is highlighting it. You mentioned doulas, having more access to midwives as well. How do we turn the healthcare system around, which is currently failing women that look like me?
There needs to be the political will and the efforts of many people to put the money into and the votes into things like the Momnibus bill. There's a Momnibus bill, as you mentioned, in California. There's also the same name of a collection of 12 bills in a package called the Momnibus before the Congress. This was started with Kamala Harris, and it's co-sponsored by Representative Adams and Representative Underwood, and many others have signed on to it. But we need the political will to pass the bills to support more doula support, more the training of more midwives. We need to increase midwives. We're the only country in the developed world where 90% of the births are attended by obstetricians. Every place else, England, Europe, and everywhere in the world, midwives midwives have always attended the majority of births. So that's what we need, and we need more people behind it and more votes behind it.
All right, sounds like a good start coming from a professional like you who knows exactly what we need. Thank you so much, Leslie Farrington, for joining us. Dr. Leslie Farrington, for joining us. It was a pleasure having you.